Welcome, everyone. You're at the Ohio Statewide Family Engagement Leadership Summit. We're so glad you are joining us today on this day of professional learning, meant to take family-school community partnership to the next level. My name is Hadley Bachman, and I will be this session's moderator. This is session 16, Supporting Mental Health of Students with Families in Mind. If you have any questions, concerns, or technical issues, please message me privately in the chat. To ensure that we all get the most out of today, we are asking and thanking you already that all of you have your webcams and microphones off. I'll be turning mine off as well. If you have questions for the presenter, please use the chat feature and I will pass along those questions. And you can join the conversation on Twitter. Be sure to use the hashtag #ChartNewTerritories to share your thoughts. Please join me in welcoming Nakia Hudson from the School-Based Behavioral Health Services at Nationwide Children's Hospital. Welcome, Nakia. We're so lucky to have you presenting today.
Thank you, Hadley. Can you hear me okay?
We can, thank you.
Awesome. Good afternoon, everyone. Happy Friday. As Hadley mentioned, my name is Nakia Hudson, and I'm currently the program manager at our School-Based Behavioral Health Services with Nationwide Children's. I have approximately 17 years of experience in the field, starting off as a school-based mental health clinician here at Nationwide Children's, and I've also worked in various other districts as a BH partner in schools such as Youngstown City Schools, as well as Baltimore City Schools in the state of Maryland. And in most recent years, I've been more in the management leadership realm here at Children's Hospital, working as a project manager initially, and then working in our behavioral health intake department before transitioning into this current role as the program manager for our school-based behavioral health services. And so I'm really excited to come full circle and be in this opportunity to talk a little bit about what are some ways in which we can engage families as we try to address the kind of the phenomenon going on with mental health in children. And so today what we want to do is increase awareness of current trends related to mental illness in youth. We want to understand various frameworks that are designed to provide student, patient, and family-centered support. We want to share strategies to cultivate mental wellness in students, share strategies to engage families to foster support and resilience, as well as just discuss mental health implications for caregivers and strategies for wellness. And so with this particular platform, as it relates to On Our Sleeves, we're committed to providing every community in America with free evidence-informed educational resources necessary for breaking child mental health stigmas and educating families and advocates. We also support access by connecting to trusted local resources. And so you may have seen these statistics, particularly in more recent times as we've started to understand the stigma being addressed and increase in awareness around that. Kids have, 1 in 5 kids have a mental illness, and suicide is the second leading cause of death among persons aged 15 to 25. We also know that 50% of all lifetime mental illnesses start by age 14. In terms of the burden, 11% of children ages 8 to 11 have had a mental illness with severe impairment. 22% of our teens have had a mental illness with severe impairment in their lifetime. Only 40% of our youth with a mental health disorder receive any type of behavioral health treatment. And there's a number of reasons as to why that might be the case. Stigma, obviously, again, being one of them. The other aspect could be related to culture, it could be related to access issues as well. And so if 50% of lifetime mental illnesses start by age 14, then 75% of lifetime mental illnesses start by age 24. And so these are, statistics that would make it evident that of the importance of trying to address mental health. We also want to be mindful of the fact that it doesn't discriminate. And so a few statistics here speaks to the suicide rate for Black children, ages 5 to 11 being nearly doubled. Suicide attempts for Hispanic girls grades 9 through 12 were 40% higher than those of non-Hispanic white girls in the same age group. our LGBTQ plus youth report experiencing high levels of depression than our non-LGBTQ plus youth. And then with regards to our Asian American and Pacific Islander youth, they're likely to experience mental health problems as a general population, but half as likely to seek mental health services. When you think about mental illness and the intersectionality with other conceptual frameworks such as adverse childhood experiences and social determinants of health, it reinforces the need for mental health and wellness and implementing evidence-based programs rooted in prevention and early intervention and treatment. Research links adverse childhood experiences to other concerns related to mental illness, substance use, and chronic health issues in adulthood. And without the effective prevention intervention efforts, it can ultimately impact the ability to obtain education, job opportunities, as well as earning potential. This ultimately leading to the intersection with social determinants of health, or the economic and social conditions to which people live, learn, work, play, worship, and age in, and the contributions in terms of the potential barriers that it has in terms of access to treatment. Some of the things that we want to kind of root this conversation in is some things that have happened in more recent months and years as far as the COVID-19 pandemic. And so we all have experienced this in some kind of capacity, whether we've contracted COVID or know someone who's been impacted for it. It has become essentially a new threat to our safety here, and we've just been dealing with a lot of conflicting information and just the uncertainty of the vaccine being available to all of our youth. That in and of itself, has led to constant changes from, working in the office and then working from home or hybrid, kids, being in a school setting, but then, going home or being hybrid or starting in the person and things changing. So there's constant changes, constant disruptions in their routine, inconsistent expectations, different things that we look forward to being canceled. And ultimately, this kind of lending insight into how this affects our mental health and well-being. And so, this situation has been very traumatic, for a lot of individuals, especially if, it's incurred a loss or a death. It's also increased stress among everyone, just in terms of trying to understand how to navigate this pandemic. Grief, related to loss, whether it's loss of a loved one, loss of work, loss of other, major things such as housing or whatever that might have been impacted economically. Depression, anxiety, we've seen an increase in that. And, one of the things that we also want to be mindful of is the potential increase in bullying because of everybody's opinions around whether you should wear a mask or not, or get vaccinated or not, and how that translates over to, school as well as on social media. The other thing that it's important for us to be mindful of, in addition to the COVID-19 pandemic, is just the increased awareness of our social and racial injustices that have really taken a heightened awareness thanks to technology and social media. Youth from our marginalized communities have been impacted as it relates to the Black Lives Matter movement, the Stop Asian American Pacific Islander hate, as well as Protect Trans Youth movements. Going back to COVID, our Asian American Pacific Islander youth population, as well as the general population, has really incurred a lot of stigma as it relates to the perceived understanding of where COVID originated. And so that particular situation has increased over the past, 18 months, and has impacted the youth there. And then as it relates to Protect Trans Youth, there's just been a lot in, the current media and, policy making as it relates to trans youth and whether or not they are able to participate in things like sports, based on gender. And then, of course, the Black Lives Matter movement, having been something that's been around for a few years, but definitely increased in terms of awareness and traction, given the events around George Floyd and Breonna Taylor, so on and so forth. And so it's one thing as a kid and a teenager to feel like you're not seen or heard, but when you compound that with, other attributes around race and ethnicity and gender and the value or lack thereof of these attributes by members of society, it's understandable that our youth are struggling. And so what does this mean in terms of providing student and family-centered support? So there's a couple of different frameworks that I want to talk a little bit about just to kind of root us in the conversation around mental illness in youth. And what you see here is a reflection of a comprehensive model as it relates to being able to address behavioral and mental health needs across the continuum of care based on acuity of symptoms or as the needs increase. And so prevention and consultation services are going to be the foundation and is integral in helping us keep youth in their communities and in their natural environments. As the acuity level increases, there's various levels of care that can be offered to our patients and families around outpatient mental health care, various intermediate levels of care such as intensive outpatient or partial hospitalization program, residential support, crisis, as well as inpatient. And so any mental health agency or organization, if they offer a number of these different levels of care, it can be considered pretty comprehensive. In addition to that, care coordination, case management efforts are really important because it helps to coordinate services, because oftentimes we have youth not just in one system, but in multiple systems. And so potentially mental health system, potentially the courts, potentially children's services, and school would be considered one as well. And then those services can also help to address other factors as it pertains to our social determinants of health. In addition to that, with regards to research, it's important to help inform effectiveness in providing equitable and quality patient and family-centered care to reach best outcomes. As it relates to the educational system, the state is really moving this whole child approach as it pertains to broadening the school and district's focus beyond academics to include meeting students' social and emotional, physical, and safety needs. And so the idea is that meeting these needs are foundational to a child's intellectual and social development and necessary for students to fully engage in learning. And addressing the needs of that child, starting with parents and caregivers and extending that to schools and other government community partners that serve children and intersects with the schools. The idea would be to focus on those core areas around healthy behaviors, services to students and families, engaging others, as well as providing safe and supportive school environments. And then in addition to that, we want to look at designing school-wide systems based on student success as it pertains to a multi-tiered structure of support. So this would be very familiar to those educators in the room as it pertains to how, in order to maximize your reach, you have to have various tiers of interventions, both for academic instruction and behavioral and mental health response. And so we model this care off of what's reflected, such as the PBIS structure around positive behavior interventions and supports in schools, which again allows us to maximize our reach, but offering our diverse menu of services. And so this would be an example of what that model will look like, as well as how the various services would be funded. And so when you think about Tier 1 or universal school-wide interventions, these are going to be mostly your prevention programs that reach a larger audience to really impact school culture and climate. And so looking at cultivating a culture where pro-social behaviors are promoted and undesirable problematic behaviors are inhibited, which then fosters a climate where students feel safe and supported. Tier 2 would be those interventions where we're targeting students that might be at risk due to signs of instability. They could be moving, quite frequently and starting over in multiple schools throughout the course of the school year. They could be getting suspended regularly or missing a lot of school. And so this is where mostly prevention program would come into play. An idea would be to intervene, prior to things getting worse. And oftentimes those programs and services can be supported by different funding grants, such as your different county boards. And then with regards to tier 3 intervention, this is where mental health treatment comes into play, where you're providing individual and family interventions. And the idea is that this particular student might have a known or unknown mental health disorder, and the significance of that disorder has created challenges and has impacted their ability to function in their environments, including school, home, or elsewhere in the community. And so all of these 3 areas, there's ways in which we can engage families. Obviously, with mental health and treatment, the idea would be to provide family-informed care or family therapy as appropriate based on what the need is. But when it comes to like tier 1, tier 2 interventions, oftentimes it's a matter of just increasing education and awareness that these are the things that's going on in the school. And when groups are involved, sending information home to families so that they know what's going on with their students, with their child, and what they're engaging in, and getting support for that. And so to talk a little bit about some examples of the services that we provide on a school-wide level, there are certain prevention programs that target education specifically as it relates to teachers, families, and students. And so at an elementary level or even early childhood level, from birth to kindergarten, there are the PACS Good Behavioral Game, and there's Triple P, as well as going into middle school, high school, signs of suicide curriculum. And the strategy around these school-wide supports is doing a needs and readiness assessment, doing staff training, doing wellness education for students and staff, as well as leveraging different educational campaigns such as On Our Sleeves, with the objective to improve school climate, enhance social emotional learning strategies, reducing disruptive behaviors, and improving academic performance. And so Triple P specifically, it's positive parenting program is what Triple P stands for. And it's evidence-based education and support for parents and caregivers rooted in a population health approach. And so the program is designed to prevent behavioral, emotional developmental programs in children, reduce the incidence of child maltreatment in the community, enhance the knowledge, skills, and confidence of parents, and then build upon parent strengths and ability to be self-sufficient and self-reflective. With this being an evidence-based program, there has been some research to help inform the effectiveness of it. And so there's one trial that came out of South Carolina in which through the research that was conducted, they found that there was 13% fewer injury-related ER visits, 21% fewer out-of-home placements, and 31% fewer substantiated cases of maltreatment with the families involved. As it relates to social emotional learning, the PACS Good Behavioral Game is another prevention program, evidence-based prevention program, in which is teacher-driven as a part of their daily maintenance of their classroom. And so the program is rooted in social and emotional learning, adhering to the PBIS framework that I referenced earlier, with the goal to be building self-regulation by reinforcing desirable pro-social behaviors and inhibiting unwanted problematic behaviors, and also incorporating the principles of trauma-informed care. And so this slide just reflects kind of the areas in which our PACS Good Behavioral Game is being rolled out and implemented in. And as it relates to the effectiveness of it, the idea is that there's going to be more nurturing classroom environments. There's going to be an increase in academic performance as well as improvement long-term outcomes. And so typically their classrooms are reporting an additional 40 to 60 minutes of instruction, 60% decrease in discipline referrals, 20 to 30% decrease in special ed referrals, as well as a significant increase in math and reading scores. And then more long-term effects is a reduction in suicidal ideation, tobacco use, alcohol dependence, as well as other substance use, in addition to violent and criminal behaviors. In terms of our older kids, at the middle and high school level, we do have prevention services centered around the signs of suicide, in which the idea is to train adults and students to be able to recognize and understand and identify depression symptoms and those warning signs. We also want to teach them actionable steps so that when they're encountering suicidal behavior, they know how to address it. And then also increase help-seeking behaviors as well. And so, the reality is that we do encounter unfortunate situations where youth are engaging in suicidal behaviors and are dying by suicide. And it speaks to the need for us to be able to do early identification and screening. And in addition to this particular program, research in terms of randomized controlled trials has also shown a 40 to 64% reduction in self-reported student suicide attempts at a 3-month follow-up. So the idea is that if this is something that we can roll out, again, from a population health perspective, research has shown that the amount of suicide attempts are actually reduced as a result. As it relates to Tier 2 targeted interventions, again, these are targeting students that might be at risk. And so this is where a lot of group programming comes into play, specifically evidence-based programming, whether it's related to substance use, youth violence, social skill building, self-regulation, crisis support, intervention, things of that nature. And so in addition to providing individual support and intervention, there's support provided to classroom in a form of consultation and observation, as well as parent education. Again, the idea is to enhance resilience and social emotional learning strategies and reduce symptomology. One example of this program relates to Whole Child Matters. And so this is a initiative that was started about 5 years ago, and it's targeting our early childhood mental health classrooms. And so our early learning centers, and whether it's preschool, Head Start, at-home daycare providers. And the idea is that we know that we have young kiddos that engage in problematic behaviors to the point where they're at risk for being expelled. And the unfortunate thing is that oftentimes, once it starts that early, unless there is some sort of early intervention, it just sets the tone for their trajectory and for their journey in school. And it reminds me of, the concept and the real issue around the school to prison, the pipeline. And so with regards to the Whole Child Matters initiative, the idea is to provide training and workforce development. And so reaching out to early childhood professionals and providing training around different classroom management strategies, as well as to provide training as it relates to just cultural and race issues and bias and how that shows up in the classroom, particularly around our young children that is from marginalized communities. And we also have this prevention hotline where we have organizations throughout the state, including Nationwide Children's Hospital, that provide consultative services to early childhood providers, whether it's administrators, teachers, directors, or what have you. And they have access to this hotline where they can call requesting help because they have a young kiddo in their classroom that's at risk for being expelled from preschool. And so they would go out and provide some support to them with the intent to try to keep them in that environment. Another program that is out there would be to provide dialectical behavioral therapy, and it's a group setting in which the idea is to help adolescents manage difficult emotions and cope with stress and making better decisions. And, they're really working on interpersonal skills, understanding mindfulness, emotional regulation, and distress tolerance. And with all of these interventions, we know that families are going to be integral to the success of that. And so, even if the targeted audience is going to be like the teacher, for example, in terms of helping them navigate, that setting, the idea would be to engage the family into that practice as well. So that way they can gain the most outcomes with that intervention. And then when it comes to Tier 1 intervention, again, this is primarily where you're going to see students engaging in therapy services, individual and family services, and it looks, different, based on different BH partners and schools. But with regards to the model that we provide, we're really looking at evidence-based therapeutic practices around trauma-informed care, motivational interviewing, cognitive behavioral therapy, as well as cognitive behavioral intervention for trauma in schools. Really enhancing family therapy work and providing bridging services as needed to help fill in a gap in the meantime until a child is linked with an appropriate level of care. As well as providing additional adjunct services in the event they need some extra support in school while being seen by another provider, and ongoing services. The program in and of itself would be to really engage the family and individual in treatment. And it's an integrated care approach where we're working collaboratively with psychiatry and other health services that are being provided in our school settings. And it also includes consultation with school staff and 24/7 crisis support, as well as multi-system collaboration as needed. And those services are being offered in a number of different districts here in the Central Ohio area, including Columbus City Schools, Bexley, Canal Winchester, Reynoldsburg, and 2 charter schools, including KIPP and Arts and College Preparatory Academy. And that's a total of 73 schools, so the need is definitely there, and continue to increase, and also partnering with other BH providers in the community to meet the larger population and their needs. And so in terms of the role that you all as educators and parent mentors and so on can do to help cultivate students' mental wellness, it really starts with having conversations, because that is the quickest way that we're going to be able to work towards breaking a stigma. And we know that, having conversations about mental health can be difficult. And we know that kids aren't going to be volunteering information, especially if they're being asked. Sometimes they probably won't even do that. But it does help set the stage for future talks once you start to kind of develop that rapport, and it helps them build emotional language so that they can be able to kind of recognize and empower themselves to be able to navigate the emotions and the feelings that they are encountering. And so wondering if, some of you can just share from your perspective, what are some potential barriers? I know oftentimes people feel like they're not a mental health expert. Maybe they don't know where to start, or they're concerned that it can just get scary pretty quickly. But what would be some barriers that you all might encounter in terms of being able to have these conversations with the young person in your life, if you want to listen in the chat? Anger, refusal to talk. And with regards to anger, oftentimes anger is like the tip of that iceberg. That's what people are showing. But underneath that anger, it's a lot more that's there. It's very layered. It could be more around abandonment, or it could be, sadness. But when we don't have an emotional vocabulary to understand all of the complexity of the emotions and feelings that one have, we oftentimes just see it as anger, and it's expressed as anger. In terms of refusal to talk, oftentimes when the relationship isn't there, it can be difficult for somebody to open up, which is why it's important for us to try to develop that relationship very early on before there's even an issue. So that way, when the issue does become known, that person already trusts you enough to be able to share what's going on. Vocabulary comes out as the F word and tears. Yeah. Lack of resources in rural areas. Yeah. Yeah, I mean, these are a lot of valid and legitimate barriers. I think sometimes we also think that, well, the students don't have the problems because maybe they're not experiencing or demonstrating externalizing behaviors. Maybe it's more internalizing, and you would never know what's going on unless you actually, have a conversation with them, or the assumption that they're too young to experience anything, which is also not the case at all. Given the fact that we just talked about how there's a whole program dedicated to trying to prevent kids from being expelled from preschool. And so definitely want to acknowledge those barriers. I kind of want to talk through that. Yeah, using I want to kill myself as a way to express their feelings. Yeah, I mean, it's getting down to like, what really are they trying to say? Because again, if the idea is to help enhance and build their emotional capacity and vocabulary, then they could be intending for it to be something else. Or it can very well be, I want to kill myself, and it's something that needs to be taken seriously all the time. Yeah, underlying family dynamics, yes. Yes, and this is where, those family dynamics oftentimes is what's causing, it's what's they're bringing to school. How many times do we come to work and we have a hard time checking our issues at the door? Oftentimes kids have a hard time checking their issues at the door as well. And so, yes, those underlying family dynamics might play a part, and really recognizing when there's a need to get patients and family into treatment. Mental health promotion is not asking students to share private information. It's not searching for a mental health diagnosis or symptoms, and it's not something that only mental health providers can do. And so, it's one of those things where it's really checking in, just really starting that relationship and starting those conversations, and recognizing that as you continue to build that, those individuals will start to open up and be able to engage in dialogue, particularly when something's bothering them. I talked a little bit about cultural considerations and how that plays in terms of mental illness. And so, there's a number of different resources that is available on the On Our Sleeves website that speaks to some of the challenges that we've encountered over the past few years. Kids and race-related violence, how to talk to kids about gender identity as well as microaggressions. And so there's a couple of different questions that are provided here on this slide to kind of get you to think about how you can start a conversation with the young people in your life. And I would even go to venture to say, like, some of these questions are very general, that you can pose these to even the families. And so when you think about it, it doesn't necessarily have to be to that particular student, but if there's an opportunity for you to connect with the family, the parent or caregiver, you can easily, say to them these same questions to try to get them to open up and have a conversation. We want to try to foster a child's emotional development. So we talked a little bit about that already. There is a video that's here that you can look at on your own time. But the idea is that we want to identify emotions and what they mean. We want to recognize those emotions as they're feeling them, noticing and understanding emotions in others, expressing them appropriately, and being able to regulate strong emotions through individual coping strategies. We also want to foster resilience. There is the aspect of adverse childhood experiences, which, if anyone knows anything about adverse childhood experiences, it really speaks to the fact that throughout our childhood, we may encounter different experiences or events that can be considered potentially traumatic in nature. And in the absence of having protective factors, it can definitely lead to long-term effects. And so when you think about whether or not you've encountered abuse of some sort or some kind of neglect, disruption in your household structure, homelessness, instability due to family mental health issues or substance use issues, those are all things, including bullying, as an adverse childhood experience, that can really play a factor into whether or not mental illness is something that kids start to encounter in the absence of the protective factors here. And so everybody goes through things, and not everybody is impaired by it. And really that's about the resilience and the ability to adapt in that face of adversity. And it's not so much as trying to avoid negative emotions or distress, because you definitely want to acknowledge it and create space for it. But it's about how you navigate it and what you have in place to be able to help you combat that, whether it's having access to mental health care, having positive relationships, including, with caregivers or peers or teachers, and just, being in a position to cultivate safe settings and stable settings for those young people. The other thing we would have to consider, as we encounter, changes, particularly now, because we're still in the thick of this pandemic, and very quickly after the start of the school year, we've noticed that things are not as stable as they should be at this point, or could be rather. And so many districts might be considering going back to virtual or hybrid just until things start to die down a little bit with the transmission rates and things like that. But ultimately, when you're dealing with, change, sometimes you have to really start to look at forming new habits. And these are some strategies in which you will want to go about doing that with regards to your young people. And so whatever that new habit is that you're trying to create, identify reminders and make it visual for them to be able to access it easily. Establishing some sort of routine so that kids know specifically what's expected of them, practicing it together and making sure that they're actually capable of doing what you're asking them to do, as well as rewarding them in terms of the behavior that you are encouraging in the event that they're able to complete it, rewarding them for that and making it meaningful. In terms of strategies to connect, there could be still challenges in terms of connecting with students and families, especially depending on the current status of the various districts that you guys all support. And so, keeping your communities up to date on your organization plans, definitely continue to leverage, virtual platforms, leveraging other forms of communication and mediums like newsletters, phone calls, emails, trying to connect through spotlighting students, school staff and or students, partnering with your community agencies to also help meet the needs. Many agencies, including ours, really leaned into technology and telehealth to address the mental health needs. And for many people, while it may have served a barrier for some, for many people, it helped to increase access to services. And so it's definitely something that we were able to lean into and leverage to better meet the needs of our students and families. And again, just going back to emotional check-ins. And so sometimes when we're talking about engaging families that's also already dealing with a lot of stress. I mean, just think about your own kind of circumstances in which, you might be dealing with stress and homeschooling and, economic challenges or whatever the case may be. These are things that our families are also experiencing. And so sometimes it's about just checking in about how things are going and not even making it about what's happening at school, because it demonstrates being able to see somebody for who they are in terms of what they're experiencing and being able to hold space for them in that aspect versus inquiring about or checking in or addressing a matter that may be not as high of a priority in terms of meeting basic needs, for example. Providing care packages, educational packages, providing links to resources, or partnering with other organizations, again, would be helpful to learn in which ways you can continue to provide support and help meet those needs. You also want to just be aware of, when is it time to make a referral for services? And so when you think about the pandemic or, the different social and racial injustice issues that our youth are facing today, are there responses to that beyond what would be considered typical? Are there significant barriers to their daily functioning? Is it significantly impaired? You also want to think about whether there's a pre-existing mental health diagnosis, or are there other dynamics or factors that could exacerbate their symptoms. And so really thinking about what's going on so that you can determine when it would make sense to just go ahead and engage that family in the idea of making a referral for services. And again, with telehealth, it really allows for us to lean in and to potentially reach families. Oftentimes what we experience is that families can make themselves available on their lunch break, whereas before there might have been issues because they're at work and they can't get off work or whatever the case may be. And so really being creative and innovative with how we leverage technology to reach our patients and families. And then also just knowing and working with your community BH partners, knowing how to make the referrals to start, but also knowing and recognizing how to respond to urgent concerns as it relates to safety. There is additional content available on the Honor Sleeves website. So these are just little snippings of what you would find there. Healthy habits checklist, mental fitness challenge, sleep hygiene. We also have a campaign as it relates to the Million Classroom Project, which is going on. It started on the Child Mental Health Awareness Day back in May, leading up to the World Mental Health Day on October, I think 10th or 9th. I'm not exactly sure. I have to double check. But the idea is that we want to leverage our classrooms to really promote mental health and really reaching out to teachers to promote the awareness of that, encouraging access to the free resources and activities and information available, really engaging parents and advocates of children and mental health, and supporting them to obtain and receive that information, and making it accessible digitally. So there's that link there that you are able to access to get more information on that. And then again, there's just some additional content in terms of supporting kids in the classroom. And this is where we also want to acknowledge your own self-care, because you all as caregivers, as the adults in these children's lives, it's important that your wellness and your needs are also being aware and taken care of. And so with that being said, we really want to look at caregiver support, because the last couple of years have been a lot. And so, we've definitely weathered the storm here. I don't know if you guys know the Game of Thrones reference here, or, the Joker and It, but, we really, 2020 was a doozy. We thought 2021 was going to be better, and that was equally shocking. And so it's definitely have been challenging, and many of us have experienced some sort of trauma. And when it comes to working professionals that are in the field dealing with others who are experiencing trauma and dealing with their own trauma, we might be experiencing secondary trauma as a result of that, which could lead to burnout. It can lead to vicarious trauma, in which you're experiencing your own traumatic symptoms, compassion fatigue in the context of just being in a helping professional, so to speak. And so it's really, really, really necessary that we tap into our own emotions as well, as we figure out how we can continue to show up every day as it relates to our students and families. And so normalizing distressing emotions, a lot of what we talked about in terms of our children is also equally important, as adults, as those of us working in this field of education or behavioral health or whatever intersectionality exists for you here today. And so normalizing these emotions, normalizing stress and grief and depression, anxiety, and recognizing the fact that, given everything that we've endured over the past, 18 months or so, that general sense of discomfort definitely mirrors many of these symptoms. And many of us, have reported difficulty sleeping, having more worries, being more irritable, and just not being as interested in doing things that we used to do. Everyone experienced these emotions in some kind of capacity over the course of your lifetime, and they exist on a continuum, on a spectrum. And so many is a natural response to life events or perceived threats. And so the more we normalize it, the better we can talk about it and relate to others, and really just going back and understanding that if it starts to impair your overall functioning, then that's where you might want to think about getting some additional support and help as it relates to, seeking treatment. In addition to that, we've gone through a lot of change ourselves. And so while we're trying to get our kids to get used to new routines, we ourselves are trying to get used to new routines, and we fall back to old habits because it takes, the burden off of us to make these decisions because we're just on overload and our brain can't absorb anymore. And so really just recognizing that there is a thing called change fatigue, and oftentimes we have to be very deliberate and intentional about the changes in the habits we take part in, because otherwise we can just default back to those old routines and habits that make it hard for us to adjust to what's going on. And so we have to learn how to expect it. Oftentimes we also have to just take a step back and see things from a reality-based point of view. And we want to think about, what's long-term versus short-term, and being able to focus on what we have the ability to control, because there are going to be this sense of gravity where it's like there's things we can control, there's things we can influence, but there's things that are completely outside of our control. And so what do we need to do to adjust our environment? What new habits do we need to form? And how do we to increase our own self-care? Some common coping skills, as it relates to preparation and rehearsal, it helps to reduce the unknown. And so if you are preparing for something new, practice it a little bit. It helps us master it ahead of time. It can be a gradual progression. And when you pair that with relaxation, we know that it's going to help to reduce some of those symptoms of anxiety that we oftentimes feel physically or mentally, and allows for our brain to refocus. The other part of this is also just having a sense of emotional intelligence too, because we as adults have to understand how we show up and how our emotions come out, as well as how to pick up on the emotions of others and navigate those effectively. And so how do we learn to handle big emotions that you have? How are you able to identify and express and manage your own needs, and leverage those skills and model that even for our children and families? Any of these resources and interventions that we've talked about as it relates to helping children are absolutely reflective of what we need as well. And so self-care is important. Obviously engage in things that bring you a sense of joy and restoration, and recognizing that sometimes you need to get off of social media, especially when there's major things going on, because it could be super triggering if you don't set limits in terms of your input. And sometimes no is all it needs to be, is a complete sentence, and there's no explanation that's needed. So making sure that you set boundaries for yourself. Making sure that you find ways to show yourself love too, and give yourself grace, because we're all doing our best. And so, these are some examples of what that can look like, whether it's setting a goal just for you and you alone, creating a mantra for yourself to keep you going, scheduling that downtime to just rest and do something restorative. And then advocating for yourself, figuring out what your needs are, letting people know how they can help you, checking in with others too, and advocating for others, and just taking the time to listen to each other and support one another, and just be kind, because we all are going through a lot. And, from an organizational response for, the administrators in the room, it's important for us to be proactive. It's important for us to identify and understand those symptoms that are individual and organizational in nature that needs to be addressed, and providing resources for staff, and providing permission to practice that self-care. And so with all that being said, it's been a very challenging past 18 months in many, many ways, and we're starting the school year off, under some challenging circumstances still. And sometimes silver linings can always be found, but sometimes you have to buy some silver paint and brush on your own. And so just wanted to kind of end there to really get you guys to think about what that silver lining is and what does that mean for you. And if you wanted to share in your chat or come off mute, you can do that as well. Okay. Well, think about it. And there's information in terms of how to get involved. So there's different resources there. Additionally, there's reference information to inform the information that we've talked about today. And just wanting to thank you for what you do. And so does anybody have any questions?
If you have any questions, you can put them in the chat. Wow, I was just blown away by the resources you had to offer. I was like blowing up the chat with all of the links, but I hope people take some time on your website. There are just so many, it's a wealth of resources out there for families and for school professionals. So I wanted to also say that as people are putting in their gratitudes for you, I also wanted to thank you for sharing your time and knowledge with us today. I mean, I'm just absolutely stunned at how much there is out there. And then also just noticing, even in myself, some of the things you said about caregiver trauma and things like that, that's real for all of us who are parents. That's real for everyone who's taking care of their grandchildren and also for people who work in schools. You guys have been doing a lot and we appreciate you for that work. So please join me in thanking Nikia in the chat if you would. And there will be a 15-minute break here. We have a few minutes for questions, so I'm going to give my spiel, but if people have more questions, feel free to break in. The next session is going to begin at 2:15. If this is your final session for the day, be sure to take our survey. I'm going to put that in the chat as well. Please don't take it until after your final session. And I really do think you should stay all the way to the end if you can, but I know some of you probably have bus dismissal and other things. And then remember to keep the conversation going on Twitter using the hashtag #ChartNewTerritories and visit our website for all the information about today's events. So I'll stop talking for now so that if anybody has questions, you can unmute and ask, or if Nikia, if you have any final thoughts, you can share those with us as well. I'm just seeing so much gratitude for you in the chat. I think this was a session that people really needed.
Thank you. Appreciate it. Appreciate the love and the opportunity to connect and hold space for each other.
Thanks for coming, everyone. We'll see you in the next session.
Thank you. Have a great weekend. Hallie, is there anything you need from me?
No, there isn't. Thanks a lot. I actually have to hop into a new session soon to be a moderator there as well.